Hey everyone, Sarah Strackhouse here with RNCN, and we are talking to Dr. Johnson with our weekly live with Dr. J with Johnson Medical Associates. How are you, Dr. Johnson?
I'm excellent. Thank you very much.
Good, good. We've missed you these last couple of weeks. Elizabeth's been wonderful, but we've missed talking to you.
Well, thank you. It's a privilege to be back and looking forward to it.
Yeah. So today we are talking a little bit about Lyme disease, right? Can you tell us kind of what it is?
Yes. Lyme disease is a transferable disease from ticks, typically, to humans. It is a protozoa type infection. It's kind of a masquerader and kind of hides itself in some cases. Usually a person is out camping or out in the woods. Sometimes they may be in their backyard if they're in an endemic area, and they get a tick bite, will develop a round red type rash is the typical sign that you get from the tick bite. May develop some fever, joint pains, flu-like symptoms, and usually that's the acute phase. Usually it occurs 3 to 14 days after you have the tick bite. Okay. Supposedly the tick needs to be on you 12 hours to really get it transferred.
Wow.
So if you see a tick crawling around on you but no bite, the likelihood of Lyme is not great. Yeah. If you do have symptoms or have a tick bite, by all means see a physician and get some tests done. If you treat it immediately, then a fairly short course of antibiotics will take care of it, and you won't have any of the problems of long-term chronic type problems that many people talk about.
Yeah. Can you tell me a little bit about the actual tick? Is it a specific tick that carries the Lyme disease, or is it any kind of tick can be a carrier of this disease?
Well, there's many different types of ticks.
Right.
Typically, it's the deer tick that they originally talked about. Sure. It may be some of the other ones, but it still is typically the deer tick that gives most people and carries the actual Lyme disease.
I see.
Now, you can have other type of co-infections, which are similar type infections, but maybe from different sources. You can have Rocky Mountain spotted fever, you can have cat scratch disease, which maybe mimic it, but in looking at what's making you sick, if you didn't have a definitive tick bite and follow-up disease, then you need to look at all those issues and different types of possibilities through the diagnostic process.
Yeah. Well, it's kind of interesting you say that. I was telling him before, my sister had Lyme disease, and it went undiagnosed for years, and it got so severe to the point where she played college soccer, and for years she had to what's called red shirt, so you basically have to take a year off and then have an extra year of eligibility later. But it got so bad, they diagnosed her with mono and with all these other kind of common things. They said she probably had the flu and this and that. Then finally had to go to a specialist, probably like yourself. So can you tell us a little bit about what some of the signs and symptoms are, if there are signs and symptoms when it turns long term?
Well, the long term can be joint pain, fatigue, typically. Some people get neurological symptoms with it where they have trouble with memory, and the fatigue can be so great that you just basically can't get out of bed and function.
Those are all the things she complained about.
Exactly. Now, you got to be careful about just jumping on the Lyme disease bandwagon because there may be other items that are giving you problems or that mimic it.
Right.
So let's talk briefly about the different types of tests.
Yeah.
So if you have acute Lyme disease, you can do a Lyme PCR test, which looks at the DNA of Lyme in your system. Mm-hmm. And that is a fairly definitive diagnosis. Okay. Then there are Lyme antibody tests to see whether you've been exposed to Lyme or not. And there's an IgG, which shows past exposure, and an IgM antibody, which shows for immediate exposure. It takes a few days for that to occur. So if you have that Harold rash, that big round rash, you may not have antibodies by that time. Right. But you should have PCR, the DNA, which is present. And then there's the Lyme Western blot, which a lot of people are familiar with, and is maybe one of the first tests some doctors will run, which looks at another antibody test to different proteins that different organisms may have. And so for Lyme, the CDC has said you have to have so many different proteins to add up to Lyme for past exposure, which is 5 different ones. And for acute exposure, you have to have 2 of 3 on the Lyme Western blot.
Sure.
And that's the IgM part of it. The IgG is the past exposure. Now, on the chronic Lyme, the caveat is that other type of viral infections or other types of antibodies can cross-react with the Lyme antibodies, or even the Epstein-Barr antibodies as you're talking about.
Right.
So one of the things that I see very frequently on people that aren't getting well with the typical Lyme treatment of either the short course of 10-day treatment if they were initially seen, or if you have Lyme, then typically they'll treat you for 30 days with a more intense antibiotic regimen, oftentimes IV antibiotics for 30 days. If you aren't clearing up with that, then you may have mold exposure, because the mold antibodies will cross-react and cause false positives.
Wow.
And I see numerous people that have had that problem.
Right.
And they present with very similar neurological problems, because with mold, as we've talked about in prior sessions, you have the allergy aspect of it, the infection aspect of it, and then the toxic aspect of it. And the toxic aspect can cause memory problems, suppress the immune system, or even enhance it in some cases, causing the joint pain, the GI problems, the fatigue, and the whole thing.
Wow.
So I see frequently that people with Lyme that's chronic are complicated by toxic mold exposure or mold exposure. So those who are continually ill need to go back and look at their housing situation, where they lived. Was there a damp basement? Did they have water leaks? Was there musty, moldy smell like grandma's old closet that they lived in? Or did they have a dorm that was sick, that had mold in it? And I've seen that frequently. So that some people, particularly out east where there's basements and there's water accumulation in it, or there's dampness, people have gone and improved their homes with new windows, tighten it all up, and then the toxins remain inside.
Right, they can't get out now.
They can't get out. And those are chemical toxins. They aren't live, but they're chemical that affect the nervous system.
Yeah.
And they're called mycotoxins, and they were kind of first discovered when farm animals were becoming sick from molded hay or molded grains, and they would have seizures and die, is the end product of it. Because we're in and out of situations, usually people don't have seizures and die, but they really get ill.
Yeah.
And so it can mimic the Lyme situation. There are some patients that I've had that had both.
Oh, wow.
And they're typically immune compromised people, where gamma globulin levels are low, so they're immune deficient. They have Lyme, they've maybe been treated for Lyme but didn't recover fully, and have had toxic mold exposure on top of it.
Right.
And so you need to evaluate the mold.
I'll have to ask her about that for sure, because I know, I mean, she, like you said, she did get better with joint pain and fatigue and a lot of stuff like that. She felt like she was sharper, but I'll have to ask her about the mold aspect of it, because, we were in a dorm in the state of Pennsylvania where, like you said, it, could have been, there were basements, and it could have been any number of one of those things. So.
Yeah, exactly. And then people do have some of the other co-infections also. Depending upon where they lived, what animals they've had at home, and so forth. And you have to be careful, because antibodies do cross-react. So you really have to sit down and look at the history, look at the sequence of events, how they got sick and when they were really sick. Yeah. And if they were sick beforehand and got worse, then there's something that made it worse, but it may not be the original thing.
Absolutely.
And so looking at all that different factors makes sense in trying to pinpoint what is the best treatment for that particular person.
Well, that was kind of going to be my next question. Is there kind of a universal treatment that can help with both those things? Is it tailored to one or the other, or is there something specific with Lyme that usually happens? Can we talk a little bit about treatment in that aspect?
Well, with Lyme, typically antibiotics is the treatment.
Okay.
And you can treat initially orally with doxycycline. If you can't tolerate that type of medicine, then there's other ones that can be used.
Right.
If you're not responding to that, then you go to an IV treatment for a period of 30 days.
I see. So how long do you take antibiotics normally for something like that?
Well, normally if you get bit and you have this big round hair spot, 10 days and you should be fine.
Okay.
So that's on the immediate situation.
I see.
Now, those people that are immune deficient, and you should get IgG subtypes 1, 2, 3, and 4 run to see whether you are deficient, because if you are, then you're going to need longer treatment. And you may want to go directly to IV if you definitely have Lyme PCR positive.
Right. I'll have to find out all these things. I wish I asked her all these questions. I'll have to ask her all of this and have her talk to you.
Well, that'd be great. I'd be happy to. So it's not as simple as some people make out, because when you take a history, you find out, well, they'd been sick before they really got bit, and this just made it worse. So is there two things going on? Or do they have a couple different infections? Or is it just Lyme that they aren't responding to the particular antibiotic?
Yeah.
And of course, with mold exposure, you have to deal with the allergy aspect of it, which you treat with allergy shots. If they're infected, you got to treat with antifungals. Some of the antibiotics that are used in treating Lyme tend to be antifungal too. So that may be why there's a slow improvement over the period of time. And in time, if there's toxins in your system, getting you out of that environment, you slowly get better. Now, there's ways that we've talked about in other sessions that tell how we enhance the excretion of the toxin, which is a chemical from the system, because it affects the mitochondria, which is the ATP production process, which causes a severe fatigue.
Yeah.
And so there's ways to do that. One way is with nutrients, as we talked about before. The other way is with hyperbaric and then IV nutrients, which is all kind of used sometimes in the Lyme treatment too.
Yeah, absolutely.
And so it's just a matter of understanding what you have, so you aren't panicking, and you say, this is the treatment course that we need to pursue for what the individual actually has.
Absolutely. And I do want to mention, so those who are watching, if you go down on Dr. Johnson's page, further down into the videos, you can, of course, see all of those previous discussions that he was just talking about. We took you through a view of the hyperbaric and mold discussion, toxin discussions. So, of course, we have all of that information down below. But I do have a question. Is this something that's common here in the DFW area?
Well, it's somewhat common in the sense that people do travel.
Right.
And they do get bit by ticks, and there are ticks in this area. It's not nearly as prevalent as out east. But yes, it does happen. And if you're feeling ill, by all means, get evaluated sooner than later to prevent complications, and then get the appropriate test run. So a lot of doctors will run the Lyme antibody test, which is good, but if it's really acute, then you need the Lyme PCR, and it never hurts to kind of correlate that with the Lyme Western blot. So there's 3 different tests that can kind of help definitively define what the situation is. Right. Now, as you said, Epstein-Barr infection may be part of it, and so you may want to rule out Epstein-Barr. In the summertime, it's West Nile virus is around too, so you may want to get a West Nile virus test, because that's a virus that can react, and that's an antibody test for West Nile. And then looking if they have animals, like look at catch scratch fever. If they've been in the mountains, then you look at Rocky Mountain Spotted Fever test. Wow. So those things all cross-react, cause similar reactions, but are tests that should be done if the history correlates with those areas.
Okay. And are there any kind of questions that you frequently get from your patients here, or any kind of misconceptions when it comes to Lyme? And I know you kind of just touched on those.
Yeah, well, the misconceptions sometimes is that you need a whole bunch of different antibiotics to treat it when the basic treatment has not been done in the beginning.
Okay.
Now, if you aren't responding, then there's a whole bunch of different protocols that individual doctors may use with antibiotics over a long period of time. My message is, if you get to that point, though, you really need to go back and look at the mold. And I prefer you look at mold up front as part of the situation because of the cross-reactivity. Now, we're talking about antibody tests, too. All antibody tests aren't made the same, and they're run different with different labs. So if something's not making sense, you may want to get a same test from a couple different labs to see exactly how they correlate or don't correlate.
Right.
There are some labs that only specialize in Lyme testing, like IGNX from California. The general big labs, Quest, LabCorp, CPL, all those have similar antibody tests. And recently, in my experience, they've been pretty comparable when you run them side by side in their sensitivity.
Right.
Now, there's some specialized tests that one lab may do versus the other one to look at some of the byproducts from the Lyme situation.
And you have, I'm not sure exactly which tests you run here, but you have your own lab here, correct? And can kind of do a lot of your testing here?
Well, we do some of our testing. Most of it with the Lyme situation, though, if it's not on your insurance plan and they won't pay for it, then we'll draw it and send it out to the other specialty labs with that.
That's great.
But if you have insurance, and it's pretty straightforward, I try to work with you and your insurance to reduce the out-of-pocket expense to get the initial evaluation.
Right.
And with the Lyme thing, that would be Lyme by PCR, Lyme Western blot, IgG, IgM, and then the antibody, IgG, IgM, to see about the exposure.
Right. For someone who might be kind of watching this for the first time, might just be joining us, we've been talking about Lyme disease and kind of a little bit how it's diagnosed, how it's found, and some of the crossovers with mold and situations like that. But you do a lot here at your practice. Can you kind of quickly go over for people who might just be joining in and a little bit about what you do here?
Yes, at Johnson Medical Associates, we try to, and we do focus on trying to find the cause of the problem. So I see people seeing 10, 15 different doctors, still aren't feeling well. And in order to get treated appropriately, you have to make the appropriate diagnosis. Yeah. So it's a matter of looking at what's the underlying situation. A pill many times just doesn't fix that. Right. So sometimes it's allergies that are kind of hidden. It can be food, it can be molds, it can be trees, grasses, weeds. Typically, like hay fever is called hay fever because some people develop fever with it and can be mistaken as an infection. Where we think of an allergy as itchy eyes, runny nose, but it may be manifested as a fever. Right.
So a little bit of everything, and you find really the root cause.
Right, and so you look for what is the underlying cause, what your immune system is doing, how it's responding. Is it substantial enough and within working order to protect you? Yeah. So many people with chronic sinusitis or chronic bronchitis or not getting well with treatment on Lyme have gamma globulin deficiencies. And gamma is the main protein in your body that helps you fight infections. Right. And if you're deficient, then you need treatment with gamma globulin. Yeah. And that changes your whole life. Other people have underlying sensitivities like gluten sensitivity versus celiac disease, where the sensitivity affects how you feel and causes inflammation. And then you get the tiredness, the fatigue, you get the joint pains and so forth. Yeah. And so there are tests to help look at gluten sensitivity instead of full-blown celiac disease.
Right. Absolutely.
And history is important, because if you have a family member back generation, 2 generations, that had celiac disease, that is a genetic trait, and that's carried through in your genetic pool.
Yeah.
And so you may only have in your body the trait for sensitivity, and it's not manifesting as true celiac, but it still does affect how you feel.
It's still good to know, for sure.
Exactly.
Yeah.
So we're looking at allergies, looking at underlying other infections, looking at toxic exposures that you may have that affect you, looking at immune system and how it may have been altered over a period of time from either genetics or from exposures, and what may be happening from that standpoint. There's all kinds of kind of weird genetic diseases. Now people are understanding that better, since they have all these genetic tests out there on the market that kind of help them focus and say, oh yeah, that may be in my family, and look back and decide how to work with it. But the kind of hidden things that I see frequently are some of these infections we've been talking about, the allergies that were related to outdoors, chemical exposures, foods, that type of situation.
Absolutely. Well, Dr. Johnson, thank you so much. Are there any other things that you really want our viewers to know?
No, I just, the main thing is, if you're sick and somebody says, oh, you got Lyme disease, and it's not straightforward and your tests aren't making sense according to how the CDC looks at it, then you may want to look forward to some of these, or look at some of these other possible underlying causes, and look back at what your situations have been and where you lived and what your exposures are and what your family history is.
All right, definitely good advice, Dr. Johnson. How can people contact you?
They can contact us at the office. You can call 972-479-0400. Okay. We have a website. It's Johnson Medical Associates. There's a contact place on there. Perfect. And that comes to me, and we'll answer back to you, and hopefully can help you. And look forward to healthy days ahead.
Definitely. And we also, of course, you feel free to comment here underneath. And we actually have one comment on one of those. I think we're getting some thumbs up there. You can also visit their Facebook page, which is, of course, connected here on this video. So we hope you have a wonderful day. And Dr. Johnson, thank you so much.
Thank you. Thanks for being here.
Yeah, absolutely.